stop. Before your next routine checkup, hear this right now. After 70, some tests that sound protective can quietly set off a chain of extra scans, invasive procedures, and side effects that chip away at your quality of life. That isn't fear-mongering. It's what both large data sets and real patient stories keep showing. One of the tests we'll cover today is tied, through cumulative radiation, to a measurable slice of new cancer cases at the population level, roughly on the same order of magnitude as the risk attributed to daily alcohol. You won't see that written across your clinic's waiting room, but you deserve the full picture so you can make choices that actually keep you safer, stronger, and more independent. Before we go further, jump into the comments and tell us where you're watching from and how old you are. Have you ever regretted a test or a procedure? What happened next? We read every message and share practical suggestions you can use immediately. And if this video helps you or someone you love, tap like, subscribe, and turn on notifications so you never miss our next evidence-based breakdown. One quick note before we start. This video is educational, not personal medical advice. Your history is unique, and your care should be too. So always discuss your situation with your clinician. Let's lock in a simple mindset for everything that follows. The goal is not to avoid doctors, ignore symptoms, or pretend tests don't save lives. The goal is to move from reflex to reasoning. Tests are tools, not verdicts. A smart plan starts with the question almost nobody asks in the exam room. If this test finds something, what happens next? If the answer is a shrug or a spiral of more tests just to be safe, that's your cue to pause, ask better questions, and tailor the next step. With that in mind, we're going to walk through 5 checkups that look sensible on the surface, but can backfire when they're used on autopilot. You'll also hear the safer pivots that deliver clarity without dragging you into a medical maze. Number 5 is the bone density scan, better known as DEXA. On paper, it looks like a no-brainer. A short appointment, no needles, low radiation, and you walk out with a number that seems to confirm whether your bones are safe. For many people, especially postmenopausal women, DEXA can guide real prevention, and major guidelines still rely on it to identify true osteoporosis and reduce fracture risk. The trouble after 70 is not the existence of DEXA, it's how reflexively it gets ordered and how narrowly that single number is interpreted. Bone mass declines naturally with age. A borderline T-score can look like a crisis when, in reality, it's a nudge for context, not a mandate for medication. And because bone changes slowly, short-interval repeat scans rarely alter the plan. What they do alter is your stress level. Once the word osteoporosis lands in a chart, a cascade can begin. Prescriptions appear even when the person's absolute fracture risk is modest. Bisphosphonates, the go-to drugs, absolutely help the right patients and lower fractures in truly high-risk groups. They're not free of downsides, though. Irritation of the esophagus is common. Rarer complications like atypical femur fractures and osteonecrosis of the jaw are the reason many experts prefer time-limited courses and carefully monitored drug holidays once risk is under control rather than continuing indefinitely by default. None of this means never treat. It means treat purposefully, not automatically. What does on purpose look like with DEXA? Start by translating the scan into absolute fracture risk instead of chasing a single T-score in isolation. Put that number next to the things that drive real-world outcomes. Medications that thin bone, recent weight change, and a decision tool such as FRAX that estimates your 10-year risk of hip or major osteoporotic fracture. Then pace, follow up sensibly. If you already have a baseline DEXA, you don't need another one every year unless something meaningful has changed. like a new fragility fracture or a major shift in your medications. And lean hard on levers that work at any age. Progressive strength training that tells bones and muscles to adapt. Balance practice to prevent falls. Protein. Forward meals with adequate calcium. Correction of vitamin D deficiency. And simple home tweaks that keep a throw rug from ending your independence. Now, zoom out from the fear a single number can trigger and look at the outcome that actually matters. Fractures. When bone density is only modestly reduced, medication barely moves the needle. In a cohort of more than 1,200 women over 70, bisphosphonates trimmed absolute fracture risk by about 0.3% over 5 years. That's measurable, but it isn't the life-saving margin most people imagine when they hear the word treatment. Meanwhile, the trade-offs are real. Digestive irritation, esophageal inflammation, and in uncommon cases, brittle bone injuries in odd places that leave people stunned. They ever started pills in the first place. Here's how the difference between reflex and reasoning looks in real life. Rose is 76 and taught piano for 4 decades. No falls, no bone pain. A daily walker, after an annual checkup, she was sent for DEXA. The report labeled her osteopenic, mild bone loss, not osteoporosis, and the prescription followed immediately. Alendronate. Within 3 months, she was fighting severe reflux and jaw pain. She canceled lessons. She turned down a recital she'd been preparing for all spring. We hit pause and rewired the plan. Off the medication for now. Vitamin D corrected. Twice weekly progressive resistance work with bands and ankle weights. A kitchen full of calcium-rich staples like sardines and leafy greens. 12 months later, she returned to the stage with stronger legs, steadier balance, and not a single fracture. That's prevention with purpose. Using DEXA as a compass, not a sentence. Before we leave bones behind, underline one idea. A quick scan can feel like the smartest move in the room, and for many, it is. But for a large group of adults, over 70 who aren't falling and aren't breaking, the smarter move is a lifestyle strategy that actually reduces risk. Strength that grows week by week. Balance that keeps you upright on a wet sidewalk. Protein and calcium that rebuild what training stimulates. Vitamin D that closes a common gap. Those are the daily choices that preserve independence, not another reflex scan. Number 4 is the brain MRI for mild memory slips. If a borderline T-score can pull you into months of worry you don't need, this next test raises the stakes. A name vanishes. Keys go missing. Headlines about dementia echo in your head, and the reflex is to order an MRI. The images are gorgeous, razor-sharp views of brain structure that look like they must hold the answer. The uncomfortable reality is that, for mild forgetfulness in otherwise stable older adults, those pictures almost never deliver the clarity people hope for. The most common findings are exactly what aging brings. A little shrinkage. A few white matter spots. They're often normal, yet once they show up on a report, they can trigger a spiral of anxiety, more testing, and sometimes even interventions that won't help memory and can make life worse. A large review published in 2021 captured the mismatch. Among thousands of adults in their 70s and 80s with mild cognitive complaints, MRIs frequently showed abnormalities, yet truly treatable causes were uncommon. In other words, lots of labels, very few fixes. A meaningful slice of those patients were nudged toward invasive next steps, spinal taps, and exploratory procedures, based on vague images that didn't explain day-to-day lapses. If you've ever walked out of a radiology suite more frightened than informed, you know how that happens. George's story makes the trade-offs tangible. He's 74, a retired engineer who still tinkers in the garage on weekends. He started misplacing keys and stumbling on names at church. His MRI showed white matter changes. Panic took over. He stopped driving. He stepped away from choir. He watched his world shrink. When we tested his thinking with a simple, validated cognitive screen, not a scan, but a short, structured set of tasks, his score was normal for his age. We reframed the MRI as age-appropriate, then rebuilt the basics: a regular sleep schedule, steady hydration, and brain training he actually enjoyed. 3 months later, his memory felt stable, and his life felt like his again. Here's the practical takeaway. Unless there are red flags, new seizures, a sudden personality change, or a rapid, obvious decline, a brain MRI rarely helps with mild forgetfulness. A cognitive screening test is a better first step because it measures how your mind performs right now in the real world rather than how your brain looks under a microscope. If the screen raises serious concern or true neurological warning signs appear, that's the moment to escalate imaging with purpose. Otherwise, clarity comes from addressing modifiable pillars: sleep, movement, mood, and medications, not from chasing ghosts on a scan. Number 3 is the cardiac stress test. If you're over 70 and mention vague fatigue or little chest tightness, this test often appears as the default next move. You walk a treadmill or receive medicine that mimics exercise while monitors track your heart's response. The goal is to uncover hidden blockages. The trouble is that past 70, especially without clear signs of heart disease, this test often creates more problems than it solves. Baseline changes accumulate with age. Accuracy slips. In low-symptom seniors, false positives can approach 4 in 10. Turning a normal heart into a danger label and setting off a run of angiograms, stents, or even bypasses that carry real risks and, for the wrong person, no upside. The numbers align with what clinicians see every week. A major analysis from 2017 showed that more than half of stents placed after stress test referrals were performed in people without meaningful symptoms. Those individuals saw no improvement in survival or day-to-day quality of life after the procedure. What did rise were complications: bleeding, kidney injury from contrast dye, and prolonged hospital stays that rip people out of their routines and rattle their confidence. That is not how prevention should feel. Raymond is 75, and the story behind those numbers. He's a retired postman who still walks daily. At a routine visit, he mentioned feeling winded on hills. A just to be safe stress test came back murky, so he was sent for catheterization. A modest narrowing was found and a stent was placed. That night, he reacted to the contrast. His kidneys took the hit. 6 days in the hospital followed, then weeks of follow-up. His original fatigue never budged because his heart wasn't the culprit. What he needed was basic and human: steadier hydration, small tweaks to pacing, and more recovery time between meals and walks. He got better not because of a procedure, but because someone finally helped him listen to his body. If you're over 70 without classic red flags, exertional chest pain, breathlessness that clearly worsens with light effort, or a reproducible drop in capacity, start with information that doesn't shove you toward the cath lab. A resting electrocardiogram shows how your rhythm behaves at baseline. In selected cases, a low radiation coronary calcium scan can refine risk without triggering a procedural cascade. And the most underrated tools of all: tuning blood pressure, improving sleep, walking with purpose, and lifting with good form do more for long-term heart health than chasing shadows on a treadmill. Number 2 is the colonoscopy. You might not expect it to rank so high, but after 70 and especially past 75 without alarm symptoms, the risk-benefit balance shifts. Colonoscopy is a powerful tool that has saved countless lives. Age, however, changes the equation. Preparation demands strong laxatives that can dehydrate and unsteady older adults. Sedation raises the odds of confusion or lingering cognitive fog. And the procedure itself, while common, carries real risks: bleeding, perforation, and in sensitive patients, heart rhythm disturbances around sedation. Large population studies show that In people over 75, lives saved are few, while serious complications can outnumber them by a wide margin. Many polyps detected late in life are small and slow-growing. Removing every speck can sometimes cause more harm than watchful waiting, especially when prior colonoscopies have been clean. Dana's story is the reality behind those numbers. She's 73, runs a bakery with her daughter, and had no bleeding, no bowel changes, and no family history. A well-meaning new doctor urged a screening colonoscopy. Anyway, a small polyp was removed, and she went home relieved until severe abdominal pain dropped her to the floor that night. Imaging revealed a perforation. She spent 9 days in the hospital, lost weight she couldn't afford, and needed months to rebuild strength. When we reviewed her record, she had already had 2 clean colonoscopies. There was no clear reason to repeat the test at that moment. That is not a failure of medicine. It is a failure of tailoring. So what does a tailored plan look like here? For most average-risk adults, routine colon cancer screening stops around 75, with decisions individualized beyond that based on overall health and preferences. If you are exceptionally fit and still want screening, a non-invasive stool test done at home like FIT often provides the information you need without procedural risks. There's no prep, no sedation, and it still flags most concerning cases. The key is to discuss options before momentum carries you into a pipeline that's hard to exit. Number 1 is the annual full-body CT scan, the most overused, most misleading, and most harmful checkup, marketed to older adults. You'll see it packaged in boutique executive exams with glossy promises to catch cancer early. It sounds like reassurance in a machine. The reality is different. A full-body CT exposes you to ionizing radiation, at doses that add up quickly. And in people over 70, it excels at finding harmless, age-related changes, tiny nodules, cysts, calcifications that look ominous on paper and drag you into cascades of follow-ups, biopsies, and sometimes surgeries that offer no benefit. There's no credible evidence that scanning an asymptomatic person from head to toe saves lives. That's why major radiology bodies advise against it for screening. Radiation is the other half of the trap. Depending on the protocol and the body area scanned, a single CT can deliver roughly 10 to 20 millisieverts, the exposure of hundreds of chest X-rays. Repeat that every year and the dose stacks up. Modeling studies suggest that current CT practices could account for about 5% of new cancer diagnoses, if nothing changes. That is not a subtle signal. Unnecessary scans don't just fail to help. At scale, they harm. Marcus is 80 and felt fantastic. He still taught martial arts to other seniors and signed up for an elite checkup at a private clinic. The full-body scan revealed a 3mm lung nodule common and usually harmless. Instead of perspective, alarms went off. He was sent to oncology, had a PET scan, and then a needle biopsy. The result was benign, but the biopsy collapsed part of his lung. He was hospitalized and needed 2 months to recover, all for a speck that never needed chasing. That's the human cost of a test that markets certainty, but often delivers chaos. So what's the wiser path when fear whispers that a giant scan will buy you peace? If you have red flag symptoms, unexplained weight loss, coughing up blood, a new hard lump, targeted imaging of the right body part can be life-saving. That is medicine at its best, focused, proportional, and tied to an action that genuinely helps. But scanning everything when nothing is wrong is like searching for treasure with a landmine detector. You may find something, yet the collateral damage can be worse than the worry that sent you looking. Let's land the plane. 5 checkups that seem protective can quietly pull you into fear, procedures, and side effects you never needed, especially after 70. Modern medicine is powerful, and it is also imperfect. The wisdom lies in knowing when less is more before you say yes to the next test. Ask the question that changes everything. If this finds something, what happens next? If the path is unclear or the risks outweigh the likely payoff, take a breath, step back, and return to prevention that pays dividends every day. Move with purpose. Eat in a way that preserves muscle and bone. Sleep deeply and consistently. And partner with a clinician who treats tests as tools, not reflexes. Now I want to hear from you. Have you, or someone you love, faced complications from a test that turned out to be unnecessary? What happened, and what do you wish you'd known earlier? Share your story below. We read every comment, and where we can, we'll offer ideas to help you navigate the next decision with more clarity and more control. If this resonated with you, hit like, subscribe, and send this video to a friend or a parent.